Please note that this educational video was developed for use in long-term care, and therefore the term resident is used throughout to describe the recipient of care. However, this information is also valuable to those providing care in other settings, such as home care and acute care. In these instances, please take the term resident to mean client, patient, loved one, or whatever term best describes the person you are caring for. Annual Oral Health Assessment Tool and Oral Hygiene Care Planning for Dependent Older Adults. An important part of providing mouth care for frail or dependent older adults is to document and track information concerning the mouth and surrounding tissues. This is necessary for developing a plan for daily oral hygiene care and to evaluate oral hygiene interventions. It also helps identify problems that may require referral to a dental professional. Completing assessments on a consistent and regular basis provides written documentation of a resident's oral health status and make it easier to identify normal and abnormal changes over time. Being able to identify abnormal changes, especially if they are a source of pain or infection, is important for getting the resident timely treatment. A number of provinces in Canada have oral health standards to guide care for individuals living in long-term care that include a requirement for oral health assessments and formal oral care planning. Oral care standardization with well-defined protocols will help ensure sustainability. There is a need for protocols that maintain simplicity, care that can be completed efficiently, and safely for both client and caregiver. In this video, we will review a comprehensive approach for oral health assessment and care planning. There are a number of credible resources developed for assessment and care planning, but we will focus on two tools that are highlighted in the Registered Nursing Association of Ontario Nursing Best Practice Guidelines. First, we will describe an oral health assessment tool developed for nurses working in the continuing care sector. Second, we will provide an overview of an oral hygiene care plan tool that is meant to guide daily care once an assessment has been done. We will provide practical step-by-step guidance on how to use these tools in order to develop or update a resident's oral care plan. Overview of Annual Oral Health Assessment Tool. A resident's oral status should be assessed on a regular basis and in a routine and methodical manner. This can be carried out by nurses and caregivers as appropriate. Nursing professionals doing assessments can benefit from education or training specific to oral health. At a minimum, we recommend that an annual oral health assessment be completed on each resident by a member of the nursing staff. And each new resident entering a care facility should have an assessment within 4 weeks of admission. The oral health assessment tool shown here is a widely accepted, validated tool for assessing various aspects of oral health status. This quick and easy one-page document is used to identify common healthy and unhealthy conditions associated with the mouth tissues and dentures. It also provides guidance for when an oral health professional should be consulted. It has been demonstrated that care providers can easily learn to follow the 8 categories to screen and record oral health status of long-term care residents. Researchers have shown that scoring the 8 categories is both valid and reliable. Some centers have added minor modifications to improve how the tool is used. For example, the Halton Region Health Department added the action required and action completed columns to make it easier to interpret the results of the assessment. How to use the Oral Health Assessment Tool. The Oral Health Assessment Tool outlines all the information needed for the annual assessment on one page, making it relatively quick and easy to use. The 8 categories we will examine are lips, tongue, gum and tissues, saliva, natural teeth, dentures, oral cleanliness, dental pain. At the top of the page, write the resident's name, the date, and indicate if this assessment is an admission assessment. This would be their first assessment completed within 4 weeks of being admitted. An annual assessment. This would be completed when residents who have been living in the facility for at least a year. Or a follow-up assessment. Follow-up assessments can be done at various times throughout the year. Frequency will depend on the scoring from their previous assessment. Residents with higher scores will likely require more attention to their oral health. At the bottom of the form, there is a space to indicate when the oral health assessment tool should be repeated. This could be annually for residents with good oral health, or more frequently, for example in 3 or 4 months, for residents who received higher scores on their previous assessment. Ideally, the annual assessment will be completed to coincide with resident annual care conferences. The date is always recorded for easy tracking. The Oral Health Assessment Tool is divided into columns. The category column lists the areas and conditions to be examined. The assessment columns are as follows. 0 or healthy indicates the resident has good oral health and no intervention is required. 1 or changes indicates that some changes are apparent and an intervention or referral will be required. 2 or unhealthy indicates that the oral cavity is unhealthy. Referral is required. Any section in these columns that is underlined or has a star indicates that a dental professional should be consulted to assess the issue. The score column provides space to add up the score from the assessment columns. The action required column provides space to indicate if referral and/or intervention is required based on the score. The action completed column provides space to indicate if the referral or intervention has been completed. For example, looking at the lips category, a score of 2, which is unhealthy, states swelling or lumps, white ulcerated patch, bleeding, ulcerations at the corners. If a resident was found to have lips in this condition, a dental professional should be consulted. If the lips are dry, chapped, or red at the corners, this indicates a change from normal. A dental professional would not likely be required to address this issue, but the residents may benefit from some sort of in-house intervention. An example of a simple intervention to address dry, chapped lips would be lubricating the lips with a water-based or non-petroleum lip balm. Once the lips are assessed, move along to the score column and place the associated score of 0, 1, or 2 for that particular area. In the action required column, use this score to determine what action is required. The final column is used for follow-up to check whether the recommended action has been completed. At the bottom of this column, write the name of the person who completed the assessment. This provides the care team with a contact should questions arise. This is also helpful if a referral is required for a particular resident. If possible, it is ideal to have the same person who completed the assessment follow up on any interventions or referrals that were recommended. This provides the most accurate assessment of change. We will now examine what is healthy, what is unhealthy, and what is considered a change for each of the categories. Lips. The Oral Health Assessment tool uses 0 as a healthy indication that the lips are normal and healthy. They should be smooth, pink, and moist. There may be a slight variation of normal, but in general they look healthy. When changes occur, you will see dry, chapped, or red areas, usually at the corners of the mouth. As mentioned, in most cases the intervention required is lip lubrication with a non-petroleum-based product. Dry, cracked lips may also be a sign that a resident is dehydrated and their fluid intake may need to be increased. Monitor the resident for 7 days, and if their condition worsens, refer to an oral health care professional. Abnormal swelling, lumps, bleeding, or ulcers associated with the lips may be an indication of a more serious problem, and the resident would benefit from referral to a physician or dental professional. Tongue. A normal healthy tongue is moist and pink. A normal tongue surface is always somewhat rough with a crease down the center. Changes to the tongue can be patchy, fissured, red, and coated. These can sometimes occur if the resident is dehydrated or if they take a number of different medications that reduce their saliva flow. It is important to keep residents hydrated. If there is a film or white coating on the tongue, a tongue cleaner or toothbrush can be used to clean the tongue. Tongue cleaners or scrapers are available commercially, but a toothbrush can work just as well. Start brushing from the back of the tongue and move forward to ensure any bacteria or residue coating the tongue is moved towards the front of the mouth to be spit out, and not towards the back of the throat where it can be swallowed. A score of 2 is unhealthy, suggesting that the resident should see a dental professional. Use a gauze to hold the tongue and check along the sides, borders, back, and underneath. Patches that are red, white, swollen, or ulcerated can be more easily seen on the tongue. Oral cancers can appear on the tongue. Many cancers of the tongue go undetected, so it is important to examine all the surfaces of the tongue and note any changes. Gum and tissues. Healthy gums and tissues look pink, moist, smooth, and do not have any bleeding. When someone smiles, a healthy mouth can be recognized by how clean it looks. When checking a resident's gum and tissues, it is important to retract the lips, tongue, and cheeks so that all surfaces of the teeth and gums can be seen. This can be aided with a tongue depressor or even the handle of a toothbrush. Changes to gums and tissues include dry, shiny, rough, red, and swollen gums. When this is noted around 1 to 6 teeth, or when ulcers and sore spots under the dentures are detected, a score of 1 is given. In the assessment tool, this area has been underlined and starred, indicating that the resident would benefit from a referral to a dental professional. Remember, any bleeding is a sign of inflammation of the gums, which is unhealthy. An in-house intervention that will resolve swollen and bleeding gums indicates more frequent or more thorough toothbrushing. Most often, bleeding gums are a sign of gingivitis. It is a result of plaque accumulating at the gum line. Regular brushing with a soft toothbrush, massaging the gum line to completely remove plaque, is the best way to address gingivitis. Signs of unhealthy gums and tissues resulting in a score of 2 and referral to a dental professional include swelling and bleeding around 7 or more teeth, loose teeth, ulcers, white patches, generalized red patches, and tenderness of the gum tissue. Saliva. If the saliva glands are secreting adequate amounts of saliva, the tissue will be moist, watery, and saliva is free-flowing. When the tissue becomes dry and sticky with little saliva present, the resident will present with dry mouth. In the case of unhealthy saliva flow, tissues become parched and red. Saliva is thick and ropey. Sometimes the tongue will appear to stick to the roof of the mouth or the cheeks. People can even have difficulty speaking when their mouth is dry. There are over 400 common medications that are known to reduce saliva flow. Since residents are often taking one or more of these medications, many suffer from dry mouth. Symptoms associated with lack of saliva include difficulty swallowing, chewing, and/or speaking. They may also have bad breath or hoarseness. Lack of saliva can lead to increased plaque formation, tooth decay, gum disease, and burning mouth syndrome. There are a number of interventions that can be considered when changes associated with dry mouth are noted. It is very important that a resident with dry mouth is well hydrated. Chewing gum and sucking on lemon lozenges are known to stimulate saliva flow. However, if these products are used, they must be sugar-free. Products with sugar can increase the risk of tooth decay. It is very important that exposure to sugar is minimal for people with dry mouth, as they do not benefit from the natural protective effects of saliva. For some people, symptoms of dry mouth can be improved with saliva substitutes, which are available commercially. Natural teeth. The category for teeth has a checkbox to note whether or not natural teeth are present. It is important to remove partial dentures when assessing natural teeth. People will often have veneers, bridges, or crowns, sometimes referred to as caps, on their natural teeth. In most cases, you can distinguish teeth that are capped by the way the light is reflected off the tooth and by its shininess. These are still natural teeth, so they should not be excluded from the assessment. Again, when doing this part of the assessment, it is important to retract the lips, tongue, and cheeks so that all surfaces of the teeth can be seen. Here you are looking for loose teeth, broken teeth, or holes in the teeth. Broken down teeth or teeth that have obvious holes or cavitations is most often a sign of tooth decay. These conditions are scored as a 1 or a 2, depending on how many teeth are affected. Residents that show signs of tooth decay would benefit from a referral to a dental professional. If there are fewer than 4 teeth present without some type of denture to replace them, the resident may not be able to chew food properly. This could impact their ability to digest food. This is also a situation that is considered unhealthy. It may require a dental professional to consider whether dentures are indicated or possible. It may also require a dietitian to be consulted to determine whether the diet needs to be modified. Dentures. Whether or not the resident has dentures should be noted on the assessment tool. Healthy dentures should be labeled and worn regularly. There should not be any broken or sharp areas on the denture. Changes to the denture can include a broken area along the edge or a broken tooth. If the resident is only wearing the dentures for 1 to 2 hours a day, this could be an indication that they are not comfortable and should be noted. It is not uncommon for dentures to get misplaced on dining trays or in washrooms. For the resident's benefit, dentures should always be labeled. This is especially important to identify when residents are being admitted to the facility. When dentures are missing or ill-fitting to the point that the resident is not wearing them, this could affect a resident's ability to eat, and proper nutrition becomes an issue. If there is more than one broken area, if the tooth surfaces are severely worn, or if the denture is missing or ill-fitting and not worn, a referral is warranted. Oral cleanliness. Oral cleanliness is very important to maintain the health of the resident's gums and teeth. Ideally, oral cleanliness means no debris, food or tartar present in the resident's mouth or on their dentures. Changes to oral cleanliness include food debris in one or more areas of the mouth or plaque and tartar on the teeth or dentures. Food or debris that does not get removed with regular brushing creates conditions in the mouth that lead to gingivitis and dental cavities. If these types of infections are allowed to progress, it can eventually affect the overall well-being of the resident. Even small amounts of food debris and tartar can cause bad breath. An intervention such as more attention to daily mouth care would be indicated in this situation. Sometimes the situation is worse, and food debris and tartar is evident in most areas of the mouth or on the denture. This suggests that the resident is at risk for infection of the gums and teeth. Large cavities in the teeth can lead to tooth abscesses and infection in the soft tissue around the mouth. Periodontal disease, when severe enough, is believed to be connected to heart disease, stroke, pneumonia, and the regulation of diabetes. It is important to brush the teeth and oral tissues at least once per day. Denture care is also an important part of a daily mouth care routine. Tartar is a hard mineralized substance that cannot be removed with brushing. Therefore, residents with widespread or severe tartar buildup on their teeth require a referral to a dental professional. Dental pain. Dental pain is perceived differently by each resident. With regard to the oral health assessment chart, if there are no behavior changes, physical signs, and/or the resident doesn't complain about oral pain, there is no reason to be concerned. Sometimes there may be verbal or physical signs of pain. If a resident is not able to directly communicate that they are having mouth pain, it is important to observe them for cues. They may wince or pull away, especially when anyone attempts to examine their mouth or brush their teeth. When they have mouth or tooth pain, a resident may show signs of frustration and aggression, or they may avoid eating. These types of signs would receive a score of 1. A score of 2 is a more severe indication of pain. A resident may have more obvious physical signs of disease such as swelling, broken teeth, ulcers, or gum boils. Many residents will be able to verbalize their pain and explain their problem. Residents with dementia may respond to mouth pain with aggressive behavior. In this situation, they should be referred to a dental professional. Sometimes the frustration and aggression associated with mouth pain is not obvious. Care providers should always be aware that the mouth may be a source of unknown pain. Follow-up. The follow-up section of the annual oral health assessment form is designed to make sure that a resident is kept on an oral hygiene maintenance plan and sees an oral health professional if it was recommended. It's important to record the dates when any specific intervention is completed or dental treatment is received. A decision should also be made regarding the most appropriate time to do a repeat assessment, given the resident's particular circumstances. Sometimes there are also reasons that a resident, family member, or guardian may refuse suggested interventions or referral for treatment. This should also be noted. Oral Hygiene Care Plan. The Oral Hygiene Care Plan is a tool that can be used to outline what a resident will need to ensure they are receiving adequate and appropriate oral care on a daily basis. This care plan should be reviewed and updated each time an oral health assessment is completed. The purpose of the tool is to identify in detail what helps and hinders mouth care that will lead to a healthy mouth. It provides a way for staff to communicate about the oral care of individual residents and can also provide a record of whether or not progress is being made over time. Let's review this tool. It is important to fill in the resident's name, date, and who completed the care plan. If they have a dentist, include their name and phone number for easy referral. The date of the resident's last dental appointment and the date for their next oral hygiene assessment and treatment can also be recorded here. Even though this plan is meant to follow the more comprehensive assessment provided by the Oral Health Assessment tool, a few details about the resident's oral situation are recorded here as well. For example, the first block is for the assessment of dentures. Circle whether the resident has upper or lower dentures or both. Indicate whether they are full or partial dentures. If the resident does not have any dentures, this should also be noted here. Record if the dentures are labeled or not. To the right of this section, record whether or not a resident is able to look after their own denture care, or what level of assistance may be required. Some residents are independent and able to look after their own dentures, while others may require some assistance or be fully dependent on others to provide their denture care. Looking to the section on natural teeth, here we indicate whether the resident has any natural teeth in either the upper or lower arch. There is also an opportunity to record whether there are root tips present in either arch. When the crown of a tooth breaks off at the gum line, the part of the tooth that remains in the arch is a root or root tip. These are often stable in older adults and not a cause for concern. However, they can become infected and need to be monitored carefully. Again, to the right of this section is a place to record whether the resident does their own oral care or whether they require some level of assistance. The bottom half of this form provides a space to record details and tips for providing daily mouth care. On the left, a variety of common oral hygiene interventions are itemized to cue the care provider about best approaches for a particular resident. For example, it may be indicated that an electric toothbrush should be used at least once a day. Or it may alert the care provider to a prescription for fluoride or various products to alleviate dry mouth. On the right is a list of regular barriers to oral care. The itemized list helps to identify behaviors that might be expected of a particular resident, such as won't open mouth or can't swallow properly. These are noted in order to better prepare the care provider to provide daily mouth care. For example, if someone cannot rinse or spit, it would not be appropriate to provide them with a fluoride mouth rinse. It may also alert a care provider that they need to have a low-volume suction machine when providing oral hygiene care. It would be appropriate for the care provider to have a low-volume suction machine when providing daily mouth care to that resident. At the bottom of both sections is an opportunity to add other notations if required. Conclusion. This oral health assessment tool has been validated and found to be a reliable screening tool for residents living in long-term care. It was developed to provide guidance to nursing and care staff in identifying healthy and unhealthy mouths. It was developed to provide a quick and easy way to record and communicate changes with a resident's oral status, and to determine when an intervention or referral to a dental professional is necessary. The resident should have an oral health assessment done upon admission to the long-term care facility. Following this, they should then be checked at least annually or whenever comprehensive care planning is warranted.